Okay. All right. I think I got everything kind of where I want it. What's that, honey? Yeah, no, I'm just trying to do this telemedicine appointment with Dr. Edelman. Dr. Edelman, yeah, the weird one, curly hair, goofball, kind of strange dude. Yeah. Oh. Hey, Dr. Edelman. Hey, I can't hear you. I can't hear you. Yeah.
All right. Can you hear me now?
I can. That's better.
Great, great. Let's start. Gosh, took us a while to get this set up. Hey, you just disappeared. Your camera's off.
Well, I can see you fine.
I can hear you, but find the camera icon on your lower left. There should be like a red slash through it.
Yeah, I see a shield.
Click on that.
Okay. Oh, I see it. Here we go. How's this? Can you see me now?
Yeah. But
okay.
You're way too close.
Closer?
You can no. You're too close. You can back up.
Oh, there we go. There we go. Hey, I'm sorry. This is my first time doing telemedicine.
Yeah. We're all having to learn this as we go through. Let's talk about your diabetes.
Sure.
Do you have continuous glucose? You're down. I mean,
you're breaking up a little bit. I don't know if you can adjust your mic or something, or.
I don't know if there's an adjustment for that. I need to see your CGM download. Can you hear me now?
Okay, great. So yeah, I actually printed them out. You give me a second. I'm just going to grab them real quick. I think I just put them right over here.
Whoa! Listen,
yeah.
Jeremy, sit down.
Yep. You know what? I can't. Sorry, I'm a little flustered. I can't seem to find them, but I actually I emailed them to you this morning. Do you mind just maybe go to your email, pull them up, and share your screen, and we can go over them together.
Sure. Let me just try to do that. Done that once or twice. Okay. All right. Well, can you see it? Did I do it right? Can you?
Yeah, but these aren't my CGM downloads.
Oh, geez.
You know what, Doc? This isn't going so well. How about we just call it quits, and we listen to Dr. Leslie Eiland. She's an expert in telemedicine. She's from Omaha, Nebraska. Hopefully she can teach you and I how to do this right.
Thank God. I mean, whatever you feel comfortable with.
Absolutely. I'll see you on the other side, Doc.
Okay.
All right.
Hi, I'm Leslie Eiland from the University of Nebraska. I'm an endocrinologist. I also have type 1 diabetes. And Steve and Jeremy asked me to give this talk to talk about pros and cons of telemedicine and how to make the most out of your telemedicine visit. So I've been doing telemedicine for 6 years to rural community hospitals in Nebraska and Western Iowa. And our division, the last couple of years, has done over 2,000 visits per year. So we're used to telemedicine, but now things have changed with COVID. So let's start with some definitions. Okay. No one really knows. There's no really good accepted definition of telehealth versus telemedicine. They're often used interchangeably. Broadly, it's an exchange of medical information from one site to another through electronic communication to improve someone's health. Medicare identifies a telehealth visit as a two-way, real-time, interactive communication between a patient and their provider at a distant site that seeks to improve someone's health. And it has to use interactive telecommunications equipment that includes both audio and video, okay? So it can't just be audio, it can't just be a telephone call. So what changed with these policies during COVID? So prior to COVID, in order to have a telemedicine visit be covered by your insurance company, it needed to take place at a place of service. And that could be a clinic or a hospital. So for our clinics, we have these community hospitals that have kind of just generic office space, generic exam rooms for visiting physicians. And so patients are seen there, and we have a local nurse that's the local face of the clinic who checks them in, gets their vitals, things like that. The visits also, prior to March, had to take place in a designated rural area, which for Nebraska and Iowa, it's not so hard. It's virtually everywhere. But all these rules changed in March due to the COVID-19 pandemic. So the visits can now occur at home. You don't need a formal place of service, and they can occur both in urban or rural areas. And you don't also have to use HIPAA compliant software. So you could use FaceTime or Skype to connect to your provider. However, most hospital systems, including ours, are still using secure video conferencing software. So why did these changes take place? I mean, in my opinion, it's the right thing to do. It should have happened a long time ago, but it's to keep people at home, right? It's to decrease the risk of spreading COVID or contracting COVID, and it can save PPE as well, right? So this is not complicated or new technology, right? We've had it for years and years. We're just finally now being able to use it to provide medical care. This is a great map from Sean and Tamara Oser, where the white boxes are counties without an endocrinologist, right? So the blue boxes are counties with one or more endocrinologists. So this is where I practice, right in the middle, which is a lot of white there, right? And so when it comes to chronic disease like diabetes, rural areas have a lack of access to specialists and therefore lack of access to newer technology, and truly do have worse outcomes. And this just didn't seem to be a priority for many people prior to COVID. But now that it's here, now that these changes are here, we really hope that they stay and they don't go away. We don't know if that's going to happen, but I do feel like this has the chance to change the way we deliver care for people with diabetes long term. So, now we know that people with diabetes that get COVID do not do as well, right? They're at an increased risk for more severe complications from COVID. And some of that, or a lot of that, is probably due to glycemic control, right? So it's more important now than ever to try to get someone's diabetes under optimal control. And therefore, at the beginning of the pandemic, it just wasn't a good idea to delay these visits. These visits still needed to take place. And so they could over telemedicine. Our clinics have been busier than ever, right? People have been calling about COVID and diabetes, about their risk. Should they work from home? Should they go back to work? Should their kids go back to school? People are needing letters. People are concerned about supplies. People need someone to look at their blood sugars, right? Because schedules are changing. And with the changing schedule comes changing insulin requirements. And so we've been making a lot of adjustments to people's regimens when their schedules have changed so drastically. And then our staff has really had to change a lot of their workflows. And for example, our medical assistants, right, when we were not seeing people in clinic in April, May, and June, they had a completely different workflow. They weren't checking people in or getting vitals. They were instead calling people who were about to have a visit in a week or two and trying to make sure that they were okay with the telemedicine visit and figure out how we were going to prepare them for that visit. So how have the clinics adapted? So we've made a number of changes in our clinic to minimize your risk if you do come, right? We're seeing fewer people in person. Visitors are not allowed unless the provider specifically approves it. We are mandating and providing masks for people who come in without masks. We have made changes to our waiting rooms. We've thrown out all the 10-year-old magazines and all the dusty pamphlets, and you can only sit every third chair. We've educated our staff on how to clean the rooms appropriately between patients, and we're doing a lot more with e-check-in. So ideally, you really don't spend much time at all at the front desk or sitting in the waiting room. You just get right into your clinic room. We've also, like we're going to talk more about, transition to remote clinics, right? And so we are contacting patients prior to their appointment to make sure they're okay with a telemed visit and review how to connect. And then we are trying to arrange pre-clinic labs, figuring out how to get their data and what needs to be available before or at the time of the visit. All right, this is a really unfortunate picture, but I covered the hospital inpatient service the first week of July, and I'd been working from home like most of May and June, and my mother-in-law texted me and said, "Hey, how's it going back at the hospital?" And I sent her this picture and said, "I'm really, making a lot of meaningful emotional connections with my patients looking like this." I mean, this is what you see, right? If you come in for a visit, most clinics require, masks for everyone, but providers in our clinic, we have mandatory masks and eyewear and gloves, plus limited visitors. You can't bring anyone with you. And you also have to go to this central screening area where maybe they take your temperature and you have to say you don't have symptoms, then you get a sticker, and then you're allowed to enter our clinic. So it's a longer process and just not as fun, right? It used to be a blast and now just not the same. So if you are still coming in person for a visit, what are the risks? I mean, you could get COVID and you could give someone else COVID. You also have increased travel time to clinic, like you always do, and increased cost, right? Cost for parking or travel costs, time away from work, time away from school. But the benefit of an in-person visit is that you get a full eval, the full physical exam. If your clinic does point of care, just finger poke A1Cs, you can get one right there. And the clinic can download your devices for you, right? If you have a pump or CGM. Let's say you decide to have a telemedicine visit, right? What are you going to have to do? Well, answer your phone, first of all, please. I mean, I don't answer my phone if it's a number I don't recognize, but you should if it's a week or so before your appointment and it's a number that may be coming from the clinic. We're trying to reach you to say, hey, remember 6 months ago, you scheduled a visit with your doctor. Well, a lot's changed, right? Like, are you okay with a telemedicine visit? Do you want to come in person? What do you want to do? So answer your phone. Then find out if you need labs, right? See what your provider wants you to get, and then find out if you want to get those or not, right? If you're due for your annual healthcare maintenance labs and they've always been fine, I don't know. There's pros and cons to delaying that or not. But I think the main thing is if the only lab you are due for is an A1C and you are on a continuous glucose monitor, I mean, maybe don't get that lab. I don't know that there's a big reason to, right? I think you and your provider will primarily use your CGM data to make changes to your insulin settings or insulin doses. And I don't know that an A1C is worth it if you're hesitant to go to the lab, right? I don't know that it's going to change a lot of things. So just say no if you don't want to get it done. Just say no to getting the A1C. Just say no to drugs. Just say no to getting bangs, jean shorts in men, like the list can go on, but just say no to that A1C during a pandemic when you're on a CGM. Then log on to your patient portal ahead of time if that's how you're having the visit. We have an embedded Zoom link through the patient portal. That's how you access your telemedicine visit. So figure out what the procedure is for your clinic, log on ahead of time, make sure your camera's working, make sure Zoom or whatever platform you're using is installed appropriately. Then get your provider the data. Ideally, the day of, ideally the day before. And if you need help, ask for help, right? The CareLink USB is like the mythical rainbow unicorn of the diabetes world. No one has it. No one remembers where it is or if they ever had one. If I had not personally owned a CareLink USB once in my lifetime, I would completely doubt the existence of the CareLink USB. So figure out how to get us your data. If you're on a pump, you may have to get a cord and manually upload it. However, T-Connect now has an app, which is more of a cloud-based system. If you're on a CGM, if you're on Dexcom, make sure you're hooked up with your clinic's Clarity account. If you're on a Libre, make sure you're on your clinic's Libre View account. People can walk you through that. It's no problem. If you're on a Libre, but just using the reader, just have the reader handy during your visit, and your provider can walk you through the history options, and you can read out some data to your provider that's actually really helpful. If you're on shots and don't have a CGM, you could potentially upload your glucometer and email us a download. You could write out your blood sugar numbers in a log and take a picture of it and send it to us. You can just have it ready and read out some numbers at the time of the appointment. I will take your data any way I can get it. Just figure out a plan. You may be asked to do a pre-appointment with your clinic to make sure that all the data is available and ready to go, right? We have like 20 minutes for these return visits. And so the first, at least in my case, and so the first 10 minutes are spent just doing IT troubleshooting and figuring out how to get your data. That's not a great use of your time with your provider, So also, make a list of questions and things you want to address. Make a list of the refills that you need. And prior to the visit, refresh yourself on how to make changes if you are on an insulin pump. Maybe it's been a while since you've changed a basal rate or a carb ratio or a sensitivity. Make sure that you are familiar with pushing those buttons. Okay, the big day. You want to set up your space. You don't need to do a credibility bookshelf with marble busts and ferns, but you could if you wanted to. That'd be great. Otherwise, just have some good lighting, have a quiet place with minimal distractions. A lot of people's visits, fall during the time when they're normally at work. And if you are, at a physical office still and not working from home, that can get tricky, just make sure that your coworkers can't hear, right? This is your private medical visit, and we don't want to make you uncomfortable, right? So go to a supply closet or go to the car. I've had a lot of visits in cars, and they've worked out great, right? Put on some clothes. If you're going to put on a shirt, just make sure to not stand up during your appointment or like stand up to get something across the room. If you can, get out of bed or just sit up. I've had a couple visits where hair is fanned out against a pillow and it's just, I don't know, just sit up. Log in a few minutes early to make sure things are going smoothly. That would be great. During a face-to-face visit, I tend to pull up someone's download, their pump download or their CGM download, and turn the screen toward the patient and go over, how I'm looking at their data and what changes we think should be made, and talk them through it. And so I think you can get kind of a similar experience from sharing your screen and pulling up your CGM download or however you're getting your provider your data. And so ask your provider if they can share that screen and walk through the changes with you. I think it's pretty effective. Be honest if you need help with changing settings to your pump, if you're on a pump. Figure out how you're going to get a visit summary, right? Normally we print out the visit summary and I try to type out any changes we're making to your regimen, any helpful links, things like that. Just a brief overview of what we addressed today, what changes we made. And so if you're not getting that in person at the end of the visit, figure out how you're going to get it. We can mail it to you, that's no problem. But much of the time on the patient portal, you should be able to access your visit summary shortly after the visit. So clarify how you're going to get that. Then ask about the logistics of scheduling follow-up. My clinic does not allow me to schedule my own follow-up visits. I've asked, they said no, they don't trust me. They think I'm going to screw it up. So it's important to figure out how a follow-up is going to get scheduled. Are you expected to call the clinic back? Is someone from the clinic going to call you? And then it's really helpful to talk with your provider about, okay, so what are we going to do next time? Are we going to do a telemedicine visit? Are we going to do an in-person visit? What do you want, right? That's the most important. So talk to your provider about what your preference is. What are the pros of telehealth? This is in honor of the newest Bill and Ted movie that just came out. You get more time with your provider. You don't have to wear a mask. In a way, it's like a little more realistic, more like an actual conversation than an in-person visit is, because you can't even see my face. You don't have to wear masks. You don't have to travel. You don't have to deal with parking. Family members can join you. Pants are optional. Your medications should be nearby, right? If another doctor added a new medicine, you can't remember the name, great. You probably have the bottle right nearby that you can grab and read it out to me. You can show me all the healthy food you've been making in quarantine. You can show me, your new home exercise setup, right? These home visits, especially when I'm also at home, they become kind of like intimate, like really fun, and I feel like I've been able to connect with a lot of my patients this way, despite it being over a screen, because we're at home or all at home and things are kind of weird right now. Cons of telehealth would be, I can't do a physical exam. I can't actually see the irritation from the adhesive of your pump or CGM. I can't see that you may be developing lipohypertrophy over areas that you've been injecting frequently or using your pump sites frequently. I can't do a foot exam or a monofilament screen, but there are ways around it, right? I mean, you can hold the camera up close to whatever area you're concerned about. You can also just take a picture and send that picture through the portal to me. So there are definitely ways around it. You don't get, the affection that you normally do at your endocrinologist, right? So gone are the hugs, pats on the backs, and high fives. You're gonna have to figure something else out instead. So in conclusion, COVID has caused a dramatic change in how we are delivering care for many other conditions, but especially diabetes. And in my opinion, this can be a good thing, right? It leads to increased access to care. It's a chance to improve outcomes. However, and this could be an entirely different talk, separate talk on its own, it can highlight disparities, right? It has the chance to further widen them, because what am I just talking about? What's important to have to really make the most out of these visits? Access to the latest technology and a stable internet connection, right? So that's a huge issue. Finally, I think telehealth may and hopefully will continue to be part of diabetes care for the long term. Newer models are being discussed, and I think your input to your provider can be really helpful about this. Some people are thinking, well, maybe we can have more frequent, shorter touch points where we just review data in between, and then once a year, we'll get together in person, do that foot exam, things like that. But the interim visit will just be, visits will just be over telemedicine. It's an option. talk to your provider about what your preference is. If you want to do more telemedicine, if you didn't like it or thought it was awkward and you wanted to do more in-person visits, and see what they say. I think it's really helpful. Your feedback is really valuable this time, right? We are all new at this. Clinics have deployed rapid changes in a very short amount of time, and we are very open to constructive criticism right now, right? What went well, what did not go well in terms of the check-in process, the visit itself, the follow-up. Let us know, right? Now's the time that we can make changes and make this better. I think it's really helpful to fill out follow-up surveys that your clinics provided you, because sometimes that data, if you were satisfied with the visit and want it to continue to be an option, can be used to prove to insurance companies and payers that this should continue as a visit option. It's also helpful if you had a good experience to be an advocate, right? A lot of changes in healthcare legislation are being made at both the state and federal level, and anecdotes are very powerful compared to just data and numbers that are being put out. So if you had a good experience, I think it's really helpful to talk about it. All right, I'm gonna stop there. I think my future self has been answering questions over the chat, and I think I'm gonna come on live. I'll have a Peloton by then, so you probably won't even recognize me. Maybe I've gotten a haircut, I don't know. So thanks everybody.